What about this? What about that?
What about that? What about that? What about that? What about that? What about this? What about this? What about this? What about this?
What about that? What about that? What about this?
What about that? 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 What about this? What about this? What about this? What about this?
What about that? What about this?
What about that? What about that? What about that? What about that? What about this? What about this? What about this? What about this?
What about that? What about that? About that? What about this?
What about that? What about that? What about that? What about that? What about this? What about this? What about this?
What about this?
What about that? What about that? What about that? What about that?
And we are back. T.P.O.T. And welcome back to another edition of the Proper Thought series right here on the old T.P.O.T. YouTube page. I'm your host, X, of course, but you knew that already. That's why your black asses are here. Tonight, now I know, we get up here and we talk a lot of shit and we do a lot of stuff, but tonight we're actually going to talk about something serious. And tonight we're going to talk about the black man's health. Yes. Now, we're not going to give you medical advice because there's no damn doctors here. I probably should have hit up old Doc Phoenix, but I didn't. But I'm going to show y'all a few articles, man, and hopefully give y'all something to think about, man, because there's a lot of talk about women's health in the news lately, the days of late. But no one gives a shit about a man's health, man. They don't care if we live or die. They don't care what we go through. They don't care if we have a heart attack, high blood pressure, aches, pains, arthritis. No one gives a shit, right? So tonight we're going to talk about the black man's health. But as always, y'all know I always start the show off with thanking you good folks for your likes, your shares, your views, your subs, and of course, your hard-earned pennies, nickels, dimes, quarters, and 50-cent pieces. Because I realize, man, you don't have to do it, man. You don't have to show up to these goddamn streams. You don't have to watch these videos. You don't have to like them, share them. And you definitely don't have to drop your hard-earned coins on this platform. But you good folks choose to do so, man. Night after night, week after week, you are here, no matter what. And I want y'all to know, man, I don't take you good folks lightly, man. I never have, and I never will. You got my word on that. I'm humble. I'm honored. I'm appreciative, man. And I'm thankful for all you good folks, man. All right. All right. So let's get at it, because I already have something queued up here. And what it's saying, good folk, is the health statistics for Black American men. That means us, y'all. But yeah, let's go ahead and get at it, because it says, and this is from verywellhealth.com/Black American Men's Health. And it's pretty recent. It's not an old article, folk. It's actually from March 15th, 2022. So it's about a month and a half old. So it's pretty recent. And what it says here is concerning the health statistics observed among Black men. It says Black men in the United States suffer worse health than any other racial group in America. For example, as a group, Black men have the lowest life expectancy and the highest death rate from specific causes compared to both men and women of other racial groups. Now, you hear that, right? Compared to other racial groups, Black men have the lowest life expectancy and the highest death rate. I know that doesn't sound too good, y'all. I know it don't. I know it sounds like doom and gloom, but I'm only reading it. It's not my info, it's theirs. But it continues. It says discrepancies in health statistics for the more than 17 million Black men when compared to others highlight a great need to do better to address their causes. There are a number of reasons that can be pointed to as causes for the issues of poor health among Black men: racial discrimination, high rates of incarceration, unemployment, a lack of affordable health services, poor health education, cultural barriers, poverty, access to health insurance, and insufficient medical and social services catering to Black men, all negatively affect quality of life and health. Here are some of the sobering health statistics for Black men in the U.S. And it says Black male health statistics. Statistically speaking, Black men live 7 years less than men of other racial groups. They also have higher death rates than Black women for all leading causes of death. Black men have a higher incidence and higher rate of death from oral cancer and have a much higher risk of developing HIV/AIDS in their lifetime. Other health statistics: 44% of Black men are considered overweight. 37.5% are obese. Black men suffer more preventable and oral diseases that are treatable. Black men have a higher incidence of diabetes and prostate cancer. Black men have a high suicide rate. It's the third leading cause of death in 15 to 24-year-olds. Wow, I didn't even know that. The 10 leading causes of death for Black men. According to the Centers for Disease Control and Prevention, the following were the leading causes of death of Black men in 2019. Number 1, heart disease, 23.7% of total deaths. Number 2, cancer, 20.2%. 3, unintentional injuries, 7.9%. 4, homicide, 5%. Stroke, 4.9%. Number 6, diabetes, 4.3%. Number 7, chronic lower respiratory disease, 3.2%. Number 8, kidney disease, 2.6%. 9, septicemia, 1.8%, and 10, hypertension, 1.6%. Now, I know y'all hear me reading this and you're like, God damn, X, this is doom and gloom. But no, it's not. Because what this is telling some of us that as Black men, we may have to start taking our health more seriously, brothers. That's what this does. We may have to start taking our health more seriously, brothers. But it continues. It says homicide, a leading cause of death for younger Black males. Shit, we already knew that, right? I know when I was coming up, they were saying that the average age of a Black man was like 21 or 22, some shit like that. So, I mean, this isn't new. That homicide, takes a lot of Black men out, especially younger folks. But it continues. It says in the category of leading causes of death, when broken down by age group for Black males in the U.S., more disturbing statistics are revealed. For young Black men between the ages of 15 and 44, the number one cause of death in 2017 was homicide. A further breakdown of deaths by age group among Black men due to homicide. Ages 1 to 19, homicide accounted for 35.3% of total deaths. Wow. That's more than a third. All right. Ages 1 to 19, 35.3% homicide deaths. Ages 20 to 44, 27.6% of total deaths by homicide. Ages 45 to 64, 2.1% of total deaths. So us old Negroes are just less likely to get shot. we die of other things. We're less likely to get shot, not like you young folks. But we move on. 2016 report on HIV risk for Black men. In February of 2016, the Center for Disease Control and Prevention released a report assessing the lifetime risk of HIV in the U.S. by state, as well as by key at-risk populations. The report revealed surprising statistics for Black men in the U.S. Among Black men, there was a 1 in 20 lifetime risk compared to a 1 in 132 lifetime risk for white men. Well, that would kind of make sense, being that it's more of them than it is us. So I'm not too impressed with that number. But if these rates continue, approximately 1 in 2 Black men who have sex with men will be diagnosed with HIV in their lifetime, a rate of 50%. Well, these statistics I've heard before. I've heard these numbers before. From reading CDC papers and reports. So I'm not surprised with what they're saying here. But it continues. This is very concerning statistic that is not easily explained, but the very same factors that affect the overall health statistic of Black men in the U.S. described above also play a complex role in this statistic as well. But like I said, I mean, I think we have to learn, man, to take our health more seriously, man. We have to do it, man. We gotta do it. We gotta do it, man. I'm gonna show y'all one more thing, man, from John Hopkins. Oh, damn, and I meant to hold up, y'all. Let me go back because I want to put this in the chat. As y'all know how we do it here. Always put it in the chat so you can read it for yourself. Don't just take my word for it. Go ahead, read it for yourself. Come to your own conclusions. Decide for yourself what's best for your Black ass. But I want to go to another one that I pulled up, and this is from the Black Men's Health Project, and it's from John Hopkins, which is, I know y'all gonna say it's the white man's data. But John Hopkins is some, white man data that you can actually, kind of take, I guess, just take it with I don't know, a wheelbarrow full of salt. I don't know. But it continues. And what it says is, it says a vision to improve the lives of black men. Both of Roland J. Thorpe's Jr.'s grandfathers died in their 60s of heart disease. They should have lived longer, says Thorpe, PhD, MS, a professor in health, behavior, and society. But certain circumstances likely shortened their lives. They were black men who lived in the South and rarely went to the doctor for preventative care. Many black men believe in health repair instead of health maintenance, says Thorpe, founding director of the Program for Research on Men's Health at the Center for Health Disparity Solutions. You show up at the ER with a condition that oftentimes could have been prevented through checkups. With an average life expectancy of 72, black men have the shortest lifespan of all groups by race and gender, except Native American men. As principal investigator of the Black Men's Health Project, a collaboration between the Bloomberg School, Tulane School of Public Health and Tropical Medicine, and Michigan State University, Thorpe wants to disrupt health patterns that have taken a toll on generations of black men. Here, he discusses the work and goals of the Black Men's Health Project, which through a survey of 5,000 black men is assembling the first national data set focused exclusively on their health. Wow, it's hard to believe that someone's actually focusing on black men's health. Can you believe it? They are actually doing something concerning black men to help black men live longer, live healthier. I'll be damned. But it continues. It says, why is there a need for Black Men's Health Project? Black men have one of the poorest health profiles in the U.S., but we're hidden in plain sight. When I started to look around in this area a number of years ago, all I could find was just basic numbers on health indicators by group, the good doc says. One thing that's missing from the paucity of research on black men's health is data on key determinants of health, such as the religiosity, spirituality, stress, incarceration, racism, and segregation that affect a high proportion of black men. Studies have looked at some of those determinants, but what makes us unique is that we've included many of those in our study at baseline to see how they operate synergistically and independently to impact the health and well-being of black men. It goes on and it says, how do social conditions like racism, segregation, and discrimination affect black men's health? These structural forces have been in place for years to the detriment of health and well-being of black men. We hope the study will shed light on how they actually work together to impact black men's health. We do know that highly segregated areas often exist with determinants related to poor health, particularly among black men, such as high crime, concentrated poverty, substandard housing conditions, and low-performing education systems. Now, I can agree with that. I mean, if you're living in an area where, it's poor, it's ran down, it's impoverished, the schools are bad, it's probably not the best place for you to get health care either. So, I mean, that kind of comes with it, right? I mean, I think a lot of times we stick color to it a lot, but I don't think it's so much of the color. I think it's, your social economic status, because I mean, if you're a broke ass a white person, you're probably not getting the best of healthcare, education, or living in the best of places either. If you're broke, contrary to people's belief, I mean, a broke person is a broke person. I mean, a lot of times we act like, being middle class. I've actually heard somebody say this, which was just the most ridiculous thing in the world. They said a dirt poor white person is better off than a middle class black person. And I'm saying to myself, how? How are they better off? Better off how? What are they? They're obviously not doing better than the black person. So how are they better off? Oh, I get it, because they're white. Just being white is better. Crazy. But it continues. Historically, you can look back to the unequal distribution of benefits of the GI Bill between black men and white men, which I believe has led to some of the huge wealth disparities that we see now. It prohibited black men from doing things like white men were able to do, that put them on a different trajectory to building wealth and the intergenerational transfer of wealth, and is a contributor to the poor health of blacks. I don't know if I necessarily agree with that. Because a veteran is a veteran, right? I don't think, because I talk to a lot of military dudes, current military dudes, veterans, retired military people, and they don't talk like this. They don't say, well, they gave the white boys the GI Bill and didn't give it to me. The white boy got promoted and I didn't. I mean, I just don't hear that. I just don't hear it. Um, if y'all remember, if you go back a few months, I actually had a show where I had like 7 uh former and current military guys on at once. And they were all talking about their experiences, and they were in all different branches, Navy, Army, Marines, Air Force. Peace, Little Rock. I see you up there, brother. What's good with it, man? And they were all discussing the military. And, I asked them about, is it a lot of prejudice and all that? And they were like, no, nowhere near. They said it was nowhere near the amount of prejudice that you would like see in the real world. Because, I mean, if y'all out there on the battlefield, I don't think you give a shit. Okay. The person that got your back and covering your ass, I don't think you care what color he is. I just, I just don't think you do. I mean, y'all are one unit. I mean, I have military people in my family, and they didn't talk about, how racist the military was and all this kind of stuff, at least not in modern times. I mean, maybe if you go back a ways, you go back 50, 60, 70 years. Yeah, I would, I would have to concede your point. But I mean, I just haven't heard it. And like I said, I talk to military guys all the time, man. Military guys around this channel all the time. Like I said, I had a show one night with nothing but military guys, current and former, and they didn't talk about all this ridiculous racism that was keeping them from, doing shit that white people was doing. So yeah. Because when I read these articles, if I see something in there or read something in there that I just don't buy, yeah, brother Little Rock said he did 20 years. 20. He said it wasn't a real issue. So, like I said, man, military guys hang out around T.P.O.T all the time. They don't talk about this kind of stuff. But it continues. The Tuskegee syphilis study often comes up in a discussion of black men's health. How has the collective trauma of the study had a lasting effect on the health of black men? The Tuskegee study of untreated syphilis in the Negro male, conducted from 1932 to 1972, knowingly withheld treatment of syphilis to study the disease trajectory in black men. The study has had a large impact on how black men approach the medical system, particularly among black men who have lived in the South. Neither of my grandparents would engage with the healthcare system, and they told me that they had no trust in the system because of what happened in Tuskegee. When I was doing earlier work talking to the focus group in North Carolina, older black men raised the same issue of mistrust of the health system because they were afraid of what doctors have done. The study has also had an impact on black men's engagement with research because they think similar things may occur. Now, I would understand that if Okay, if one of those people tested was your grandfather, your uncle, your whatever. I mean, because I get checkups and go to the doctor. I don't, I don't have the Tuskegee syphilis study in my mind. Okay. And I think the majority of black men that don't like to go to the doctor, I don't think it's because of the Tuskegee study. I really don't think it's because of that. A lot of black men don't even know what the hell that is. They don't even know what that is. So why would that be stopping them? Yeah, I got some problems with this article, but I'm going to continue to read it. Um, it continues. It says there have been worldwide protests against police killings of black men. Is it possible that this movement might lead to greater recognition of black men's health concerns? Absolutely not, because what does police killing black men got to do with black men taking care of their health and going to the doctor? And what does that have to do with that? I don't think those two things are synchronous. What effect would these protests and marches about black men being killed by the police, how would that correlate to black men's health? That I don't get. But it continues. I don't know how many black men who haven't had some experience with the criminal justice system or law enforcement, either in a car, in stores. You walk in a store and you're racially profiled, and that has to have some psychological impact. It's another layer of stress. There might be a space to talk about it with people who are willing to listen and not blow it off as just black men complaining. Going forward in a possible second wave of the study, we're hoping to get additional funding to explore the impact of COVID-19 and police brutality on black men's health. I would think that because when you talk about police brutality, the only black man's health it's affecting is the black man that's getting his ass whooped or beat or shot or killed, right? I don't think a black man being beat by the police has anything to do with my physical health, all right, or my mental health for that matter. I mean, I think they're kind of oversimplifying some of these things, man, but I don't know. But anyway, it continues. How do you envision that this project will ultimately improve the health of black men? We want to make the data available as a resource so that other scholars can use it to ask more questions. And we want to share our findings with the stakeholders like community organizations, health departments, and lawmakers to create better, healthier lives for black men. I'm excited about that because one of the key ways to enact change is to get evidence base and let it inform how we can develop health promoting strategies, health promoting interventions, and policy relevant solutions. Hmm. Had some issues with that John Hopkins. They said a lot of shit that, I'm not gonna say it's untrue, but I will say I freaking disagree with a lot of it because they said a lot of things like black men, and I'm gonna go ahead and put this in the chat for y'all too. So y'all can go ahead and read it for yourselves. Y'all know that's how we do it here. Don't just listen to my ass. Read it for yourself. Make your own conclusions. But they said that the Tuskegee study, all right, is a main cause for black men not wanting to go to the doctor. Like, I think that many black men don't go to the doctor because they just don't trust, the medical system. I think they just don't trust, the healthcare system. That's what I believe. I don't think black men are, citing there's this specific thing that black men cite and say, okay, I don't want to go to the doctor because of this. I just don't believe that. I think that many of us we just don't trust the doctor, man. We don't. We don't trust the doctor. And I mean, the full confession, I mean, I was the guy who, didn't like going to the doctor and all that shit. But, when you got a wife, she's like, oh, you need to go, oh, you get a checkup, oh, you do this, you do that. And eventually, you know, just to shut her up, you go ahead and you go to the doctor and shit and get yourself checked out, make sure your ass ain't got colon cancer, check your lungs, check all that shit, man. Check everything about you, man. You know, I mean, especially when you get a certain age, you know, young people, they probably don't have they probably don't have the issue that us older brothers have. Once you get a certain age, you're not as strong as you used to be. You're more susceptible to certain things. Take it from a brother like me, man. I'm in my 50s, and sometimes when you get out the bed, all you hear is a bunch of cracking. It sounds like somebody walking on sticks in the woods. All that happens. You have aches and pains in places that you didn't even know freaking existed on your body. You're like, damn, that's a thing. I mean, shoot, man. The other day, man, I was out and I was doing an engine job, and man, and I got a pain, man, up the freaking back of my arm, man, that just and it wouldn't quit. Sometimes I get because I work with my hands a lot, and sometimes my left hand, only my left hand, I mean, my left hand will literally draw up like, and I can't straighten it for like 10 minutes. And I don't even know what the hell it is. I have no idea what it is. Um, Someone told me that it's what the hell? Someone told me that was some pre-arthritic shit, but I don't believe that. So the next time I go to the doctor, I'm gonna ask him about it, because I mean, it's happened more than once. It's happened to me about 3 times um over the last 6 months. I mean, because it don't happen. I have to be working a while for it to happen. I have to have put in at least, you know, 6 or 7 hours. At the 6 or 7 hour mark, what happens is, man, my hand literally, my left hand will curl up sometime, man. And I can't straighten that shit out, man, for like 10, 15, 20 minutes. I mean, it refuses to straighten out, So I don't know. Like I said, somebody told me it's some pre-arthritic shit, but I don't know what the hell it is. Now, usually, after it straightens out, I'm fine. I can go ahead and rock out and work for the rest of the day. But like I said, it's happened to me more than once, man, over the course of the last like 5 or 6 months. So, shit, I'm due for a checkup. I know I gotta go, think in 3 weeks. Yeah, I'm due for a checkup in like 3 weeks. So when I go to the doc, I'm gonna ask him, like, what the hell? Why do my hand do this shit when I'm working? You know, I don't know. It might be because of what I do, because it's only one hand, my left hand. I never have that problem with my right hand, only my left. So I don't know, folk. I'm gonna have the doc take a look at it, ask him what the hell is wrong with my damn left hand. But yeah, man, it's something we need to take seriously, man, as men. I know that, we're men, and we think we indestructible, and nothing hurts us. We can survive anything, including getting hit by a Mack truck. I get it, but you want to take care of yourself, if nothing else, man. Especially if you have children. I mean, me, all my kids are grown. Now I have grandbabies, and I have my nephew and my grandson and stuff like that. But the children should be at least one of the reasons that you want to try to take care of yourself. Your children, your wife, your family, if you ain't going to do it for yourself, man, at least do it for them, man. Because they depend on you, man. They depend on you to be around. They depend on, your income so you can take care of them. They depend on your influence. Your wife, she depend on your ass, to do the things you do, within the life of the family. So, I mean, it's something you should take seriously, man. We need to, we need to take our health more seriously as black men. Ha ha! Poseidon McDowell said, "This sounds more like an activist more than a doctor." Yeah, man, because I mean, the the article, brother Poseidon, I guess he's coming at it from the whole Hotepi kind of, the little Hotepi there, because a lot of things he was saying in the article, brother Poseidon, I was like, no, no, I don't agree with this shit. Not saying that it's not true, but I disagree with the shit. Yeah, I disagree with what he was talking about up in here. But I have another, let me see. At least I thought I did. Let me see. I have this article here, brothers. And this is from the National Library of Medicine. Oh, hold on a second, y'all. Give me 5 minutes. Hold on, y'all. All right, y'all, I'm back. Somebody's at the goddamn door. Yeah, but like I was saying about the article that I read earlier, man, it was a little hotep, man. We don't need no hotep inside of medicine, man. We don't need no hotepness inside of medicine. But I have this thing here from the National Library of Medicine. It's the white man's data, but it is from the National Library of Medicine. And it talks about visible and invisible trends in black men's health, the pitfalls and promises for addressing racial, ethnic, and gender inequalities in health. Now, I'm not going to read this long ass article to y'all, but what I am going to do, because basically what it's saying is it pretty much gives you a breakdown of the annual review of black men's health, public health, and where we as black men fit in there. I'll read y'all the abstract. The abstract says over the past 2 decades, there's been a growing interest in improving black men's health and the health disparities affecting them. Yet the health of black men consistently ranks lowest across nearly all groups in the United States, which the other article mentioned before. Evidence on the health and social causes of morbidity and mortality among black men has narrowly concentrated on public health problems, e.g., violence, prostate cancer, and HIV and AIDS. The determinants of health, e.g., education and male gender socialization, this limited focus omits a specific leading causes of death and other social determinants of health, such as discrimination, segregation, access to health care, employment, and income. This review discusses the leading causes of death for black men and the associated risk factors, as well as identifies gaps in the literature and presents a racialized and gendered framework to guide all efforts to address the persistent inequality in health affecting black men. So I'm going to go ahead, put this in the chat as well. Y'all can go ahead, take a look at it if you want. If you don't, That's okay too. You may not want to look at it. I don't know. You may not want to look at it. But if you want to, go ahead and check it out. Because, like I said, y'all know I like y'all to go ahead and read these articles for yourselves. What's good, brother Perfect Black? I see you up there, brother. You know? But yeah, man, those are the articles I'm going to hit y'all in the head with tonight. You know, usually I hit y'all with a few more than that. But what I really want to do tonight is, you know, talk to my brothers, man. And, you know, tell my brothers, man, number one, man, take care of yourself, man. All right. Because if you don't take care of yourself, you're not going to be able to take care of anyone else. And I say again, man, you got a wife, family, children. If you're not going to do it for yourself, man, do it for them. You know, I think it's uh I think it's tragic when we die, when we fall dead from something that was totally preventable. I mean, it's one thing if something happens to you, I mean, some things can't be helped. Sometimes circumstances come about and there's nothing we can do about them. But I'm talking about the preventable stuff, man. The preventable things are just that, preventable things, man. You know, uh, Keeping ourselves in shape, man. Trying to eat right. Um, the last time Dr. Phoenix was here, he was talking about, especially us blue collar guys. He said, you guys are the worst freaking eaters on earth because y'all are on the road a lot. Y'all are away from home a lot. So, y'all are always, eating fast food and y'all eat a lot of cold cuts and y'all in the deli and, y'all eating, shit on the go because y'all are, away from the house a lot. And he was right. I mean, I know oftentimes, especially if I'm going to be on the road, because I have times when I'm on the road for days at a time, depending on what I got going on. I mean, I'll leave the house, I won't be back for like 2-3 days, especially if it's some out of state shit. So, when you off like that, you don't have your wife around, to cook you, a decent meal that ain't filled with grease and salt and sugar and, all this freaking, trans fats and, all this other kind of nonsense, you know, and corn syrup and, so you out there, man, you got to eat something. So, it ain't nothing for you to go to like a fast food place or, some deli or, the just something to get in your stomach, especially if you done pulled a goddamn 10-hour, 12-hour day. You haven't eaten anything all day. You got to eat something, right? So you pretty much grab what you can most of the time. I mean, I know that's how it is for me when I'm out. Um, but see, I don't eat red meat. I stopped eating red meat a long time ago. And let me tell you something, man. It wasn't easy. Um, my wife had a lot to do with it, like the majority of it. She had a lot to do with it, you know. And every now and then now, I'm gonna let y'all know, every now and then, and she knows this too. Every now and then now, I will throw me a couple deer steaks on the grill, okay? Every now and then. Not that often. Usually like maybe once or twice a year, um like New Year's or maybe my birthday, I'll throw a couple steaks on there, or maybe I'll throw a couple deer steaks on there. It all depends. But throughout the rest of the year, man, we don't eat any red meat. I mean none. Yeah, none. So I've been away from that a long time ago. So I guess that's why my black ass still alive and ain't had a heart attack or a stroke or cardiac arrhythmia yet. That's probably why that hasn't happened yet. Now, full disclosure, I am a beer drinker. Um, I like my scotch too. And I'm a cigar smoker. I will probably give up the whiskey and the beer before I give up my damn cigars. I'm just being honest with y'all. I will probably more likely be smoking cigars till my black ass is dead. That's probably a reality. I may have not drunk no alcohol in years, but there's a pretty good chance that when my ass fall dead, I'll still have the scent of Romeo and Juliet, the fucking 1857 on my breath. That's just the truth. Shout out to my Chi-Town brother, Brother Perfect Black, with the $10 super chat. He says, Black men, especially fathers with people depending on them, need to eat healthy. Yes. Stay in the gym, stay active, and get regular checkups. Cut out the fried foods, fast food, soda, and pork. Yes. I couldn't have said it better myself, man. I mean, we don't eat anything fried. Everything is baked, steamed. My wife, she has she has a big air fryer. I mean, if it get fried in that motherfucker. No grease or no shit like that on it. She puts things in the air fryer. She steams vegetables and shit like that. Like I said, man, that's probably why my black ass still alive. Cause I mean, when I was single, living by myself, before I met my wife, man, I would eat any fucking thing, man. Whatever. You know, whatever. Fucking McDonald's, Burger King, pizza. I mean, that kind of shit, man. I very rarely eat that shit now. I mean, every now and then, um, I'll have some pizza, but no meat on it. Just like cheese and garlic. I may have one or two slices of that. Um, I'm more of a seafood guy, to be honest, man. I like shrimp. I like all types of fish. Uh, not much of a crab man, but I mean, I like croaker. Um, I like perch. I like whiting. I like red snapper. I like flounder. Um, yeah, bluefish. Uh, I like tuna, and I don't mean the tuna in the can that you buy. No, I like freshly caught tuna as well. I'm more of a seafood kind of guy. I mean, that's the closest thing I get. The closest thing I get to red meat is turkey, and we don't eat a lot of that. We eat it here and there. Um, and like I said, I mean, my wife, she doesn't fry anything. She doesn't fry anything. Like I said, anything that's fried get cooks in that air fryer freaking contraption that my ass don't know how to operate. And like I said, I guess that's why my black ass still alive, because the way we eat. And my wife, she does like 90% of the cooking. So, there ain't gonna be no red meat, ain't gonna be no fried food, ain't gonna be no pork up in here, ain't gonna be none of that shit in the house. Like I said, maybe twice a year, I might get a chance to have me a steak. And that's like on a special occasion and shit. I used to would sneak out, every now and then and get me a cheeseburger and shit on the low. But I haven't even done that lately, you know. See, I do that shit when I know my wife, she just gone for like a whole day, because she come back, she'd be like, you smell like beef. You ate some beef today, didn't you? Did you eat some beef today? Yeah, man, stay away from that shit, man. But I appreciate that, brother Perfect Black. You drop coins on this platform, my brother. You get this. I appreciate you dropping your hard-earned coins on this platform. And shout out to Poseidon MGTOW with the $5 super chat. He says steak is good once in a while. Yeah, Poseidon, man. At least once or twice a year, man. I got to throw one on the grill, you know, because see, we in the South, so usually on New Year's Eve, you know what I do? I barbecue, and the kids, pop pop, shoot fireworks, because I keep fireworks. I mean, I have so many different kind of fireworks, and see, the kids know it. They know it. So on New Year's Eve, we barbecue. We go out on the deck, we barbecue, and shoot off fireworks and shit for the kids. And that's when I kind of, I get to have my steak and shit. I haven't had deer steak in a while, so I think that's what I'm going to do this New Year's Eve, because I haven't had deer steak in a while. And it's crazy because last New Year's Eve I didn't even have steak on the grill. Actually, we had salmon. Yeah, we had like some salmon. You fix the salmon up, and you put a little season on it. You wrap it up, in aluminum foil, and you put it, right on the barbecue grill. I didn't even have a chance to have no steak last one, but I bet you I'm gonna have one this time. If I don't have it New Year's Eve, probably 4th of July, because 4th of July, I shoot off like it's like Grucci. It's like Grucci here on 4th of July, boy, because I do the whole shit. I have the goddamn mortars and the repeaters, and I buy the extra fuses, so they go in like they like synchronized. Like I do a whole bunch of shit, man. Y'all will be thoroughly impressed with my fireworks displays, because I actually put a lot of time in it and set it up, to make it nice for the kids, because they bugged the shit out of my the fireworks, it's a fireworks. Be trying to get me to let them light them and shit. Like, get your little ass out of here. You ain't like nothing. But yeah, man, y'all will be impressed, man, with my firework shows that I put on, man. The neighbors come outside and look at the shit and everything. Yeah, I do it up with the fireworks. But I appreciate that, man. That $5 super chat. Poseidon, when you drop coins on this platform, you get this. I appreciate you dropping your hard-earned coins on this platform. Appreciate that, brother Poseidon. That $5 super chat. Zale. Brother Zale says, if you're not eating nothing fried, are you even living? That's what I used to think. Like, you know, you want that fried chicken, you want that fried fish, because I haven't had fried fish in I don't know how long either. I mean, all the fish we eat is like, it's baked. So, um, you get used to not eating fried stuff though, brother Zale. You get used to it, man. I've done it so long that I'm used to it. I'm used to not eating fried stuff. I mean, I guess your palate has to develop, right? Because you like certain things, you got a certain palate. Um, you ease into it. You kind of ease into it, because let me tell you something, man. My wife, she never was much for red meat. And when we first got together, because trust me, I mean, I didn't jump on the fucking train, man. We was together like 10 years and shit. I'm talking married. And I wasn't on the, no red meat train, god damn it. For like the first 10 years we was like together, she would be like cooking like separate dishes, or, she would cook a dish, and then I would cook, something for me, because, she just wasn't into meat like that. And me, I wanted that fried chicken. I wanted that goddamn beef stew. I wanted that. You know what I'm saying? I wanted that shit. And she was like, "No, I'm not eating that crap. You want to eat it, go ahead, but I'm not eating any." And she's was never much for like the fast food restaurants and all that kind of crap. But me, shit, man, I'm at McDonald's, the Burger King, Taco Bell, Pizza Hut, all that shit. And after a while, she was like, you should at least try to eat a little different, because you're not getting any younger. You know how your wife do you, man. So, oh, you're not getting any younger. You should be eating this. Just try this. Or she'll cook some shit, she'll be like, oh, try this. It's good. It's delicious. You should try it. So, after a while, it kind of, I guess she kind of wore on me a little bit. And slowly but surely, I stopped eating red meat too. I stopped eating it too. Um, don't eat a lot of meat, period. Eat more fish than anything, and we don't even eat that a lot. Uh, yeah, we don't even eat that a lot. I mean, we eat a lot of vegetables, man. I like pasta, so we eat pasta um a couple times out the month. Some pasta and some vegetables. Uh, if she wants like some fresh fish, we'll go to the fish market, we'll get some fresh fish, and maybe we'll have some fish and we'll have like some rice and maybe some peas. I mean, that's kind of how we eat. And me, I'll eat any kind of vegetable. The only vegetable I don't like is fucking broccoli. I hate fucking broccoli. And my wife always trying to get me to eat that shit. I hate that shit. She even put like some cheese and shit on it. I still don't want that shit. I don't care. If that's the only thing on earth that is to eat, I will die of starvation if all there's left to eat is broccoli. If the only thing edible in this world is broccoli, Xavier will die of starvation. Yeah, I'll just be dead. Only way you're gonna get broccoli inside of me is if you grind it up into liquid and put it in an IV and stick it in my arm. You might can get it inside my body then. I hate fucking broccoli, but I do not like that shit. And my wife, she's like a broccoli fiend. Oh, go get some broccoli. Go get some broccoli. I'm like, shit, the only person who's going to be able to eat it is you. I'm not eating that, you know? But what she will do is if she's cooking broccoli, she know my ass ain't going to eat it. So what she'll do, she'll like, steam me some peas or like peas and carrots. I like peas and carrots. That's like my favorite shit. I mean, I can eat that probably every damn day. She'll steam me like some peas and carrots, and I put a little I put a little pinch of garlic on them. I put a little pinch of garlic on them and maybe just maybe a little parsley leaves and I'm good with that. Especially if we got fish, like some croaker, like some fresh croaker or some freshly caught tuna, like a tuna steak with some peas and carrots and maybe a little bit of brown rice. Man, I'm in heaven with that shit, brothers. Yeah, that's how I eat, man. That's how I eat. And the crazy thing is, man, I don't know. Um, the less meat I eat, the better I feel. So there is that. And shout out to my brother, Perfect Black, with the $5 super chat. Another super chat. He says, Zale, aka Mac, if you're eating fried foods, then you're dying. Yeah, I'm going to have to agree with my Chi-Town brother on that one, brother Zale. If all you're eating is fried food, you're killing yourself, right? You're slowly killing yourself. If that's all you're eating, I'm not going to sit up here and say that, if you have fried chicken every now and then, you're going to die tomorrow. But, fried stuff isn't the best thing for you, brother. It's not. I knew Brother Zell was going to come back with something like that too. But let me go ahead and do a coin drop for my Chi-Town brother, because when you drop coins on this platform, my brother, you get this. I appreciate you dropping your hard-earned coins on this platform. Appreciate that super chat, Brother Perfect Black. He says, my mother died at 60 and she didn't drink alcohol and she didn't eat fried foods. Yeah, you can make that argument, Brother Zale. Of course you could make that argument. Oh, I knew somebody that died when they was like 50 and they didn't drink, smoke, or do anything. All they ate was parsley leaves and drunk water. You can make that argument, but well, let me say this. You're probably doing more harm than good to your body if you're putting a lot of fried food into it. I will say that. I will say that. You're probably doing your body more harm than good, brother. You know? I mean, and I'm not telling you what to do. I mean, I would never tell another man what to do with his life, what he eat, never. But I will say you're probably doing your body more harm than good. I will say that. All right. I will say that. God damn it. And shout out again to Brother Perfect Black showing out with his money tonight. He said fast foods like McDeath, Murder King, pork, and fried foods will put you in an early grave. I wish men knew what that does to your arteries. Yeah, man. I mean, like I said, that's probably why my black ass still alive, because I don't eat, I don't eat red meat at all. I haven't eaten it in I don't know how many years. Like I said, last year I didn't even eat my yearly steak on the grill. Shit, we had salmon instead. So, I eat red meat maybe once a year, twice a year. So I don't eat a lot of it. And it's crazy because when I eat it, I feel heavy. Like, I have like, you feel heavy. I guess because your stomach's not used to digesting it or having it in there, but it's so good that I don't give a shit. Yeah, I don't give a shit. It's so delicious that I don't care. Like 4th of July, I'm probably going to do me a deer steak. 4th of July, you know? And I'm probably going to do a deer steak. And I don't care about the heavy feeling either. I don't give a shit. But shout out to Brother Perfect Black for that $5 super chat. I appreciate that, my brother. You get this. I appreciate you dropping your hard-earned coins on this platform. Yeah, man. But I'm going to go ahead and open this up. If anybody want to come through and talk about it. The email is properthought at yahoo.com. That's properthought, one word, no caps, at yahoo.com. If you wish to come up and opine or say, screw that, fried chicken for life. If you want to come up here and say fried chicken for life, that's all right too. Fried chicken for life. But back to what we were talking about, man. I mean, as black men, man, I'll say again, man, because it's not just about you, right? It's not just about you. It's just not, man. You need to get your ass in the doctor's office, check it out, get yourself checked out. Make sure, don't you want to know? Don't you want to know if you're dying or not? Don't you want to know if you're sick or not? Don't you want to know if you got cancer flowing through your body or clogged arteries? Or, I mean, don't you want to know that? I think that's part of the reasoning we use, right? Or should I say that's what brings on the apprehension. We don't go to the doctor because we're afraid of what the doctor gonna say. We're afraid the doctor gonna say, you've only got 30 days to live. You've got cancer. You've got whatever, you know. You got a brain tumor. You got a chest tumor. You got something, you know. I think that is a part of it, you know. Scared the doctor gonna tell us we only got a week to live. Sir, you'll be dead in 7 days. What? Actually, counting today, it's actually 6. I think that's what it is, man. I think that's what it is. More than anything else, man. I think we fear what the good doctor might say. Because a lot of us, we know we're not living right. We know we drink too much liquor, smoke too many damn cigars, eat too many motherfucking bags of fucking Cheetos and too many packs of ring dings and ho hos and Twinkies and shit. We know we do it too much. We know we do, man. We know it. We may be crazy, but we're not stupid. We know we eat too much bullshit, drink too much bullshit, drinking soda. And that's another thing I don't do, man. I don't drink soda either. Now I drink beer now. I'm going to drink some beer. But that soda, man, the reason, I'm going to tell y'all what stopped me from drinking soda. And it wasn't even a health thing. You know, I'm tell y'all story time. I was working on a generator inside of a movie theater, right? This was years ago. This was 2007, 2006, 2007. Yeah, around that time. Because up until that time, you know, I was still drinking soda and I think still eating the red meat and shit. And I was working on a generator inside of a movie theater. And, you know, lunchtime came around. So, you know, we doing work in the movie theater. So, you know, you can get like, you know, free drinks, you know, because they have those fountain drinks and shit. So I went and I got, because something I used to do, I used to mix punch with Pepsi to make like a quote unquote cherry Pepsi, right? And I was drinking it and I got up, and when I got up, I spilt the soda on my watch, you know, and I'm a watch man. You know, I'm a watch man. I don't know how many watches. I mean, I probably got 75 watches. I'm actually a watch collector. That's something I think I'm going to start doing. I'm going to start showing y'all my different watches that I have, right? But anyway, I had on my watch and I spilt the soda on my watch. But I didn't pay it any mind. You know, lunch got over. We went on, we finished working on the generator and eventually left. I get home that evening, you know, I take my watch off and shit, you know, to take a shower and everything. Wake up the next morning, go to put that same watch on because, you know, that was one of the watches that I wore. You know, I got watches that I wear for work and watches that I wear when I'm not doing shit. So I go to put my work watch back on, and when I looked at it, I could see where the soda had eating through the watch, not eating through the face or eating through because the watch I had on was like a stainless steel watch. You know, it wasn't gold or silver, no platinum or no shit like that. It was a work watch. It was stainless steel. And I could see around, like, you know, when you turn it to set it, all of that was caked up, and it had literally solidified and glued that knob, and I couldn't even turn it. And that's just from soda being on it for like 12 hours and dried. It literally glued my watch so you couldn't turn it. I said, if this shit can do this to fucking steel, what the hell is it doing to my insides? And after that, I didn't drink any more soda. When I saw that shit, I spilled that soda on my watch, and that shit had my knobs and shit stuck. I couldn't even turn them. I said, that's it. I said, I said, I can't drink this shit no more. And I never drunk any more soda after that. Never drunk any more soda after that. That was like 2007, I think. Yeah, it was like 2007. I haven't drunk soda since then. So I think I stopped fucking with soda before I stopped messing with the red meat. Yeah. Yeah, because then I was still eating, you know, I was still eating red meat and shit like that back then. Yeah, I left that soda alone, man. That shit's a killer. That shit is a killer. Especially for a guy my age, man. You know, probably shouldn't drink as much fucking scotch and beer and shit as I do, but I'm smoking them damn cigars, but from my cold, dead hands. From my cold, dead hands. Especially them R&J cigars, boy. You're going to have to shoot my ass to stop me from smoking them shits. Yeah, you're probably going to have to shoot me to stop me. And you better shoot me good, too, because I'll still be crawling and shit. Cigar. Give me that cigar, you motherfucker. Give me that cigar, you motherfucker. Yeah. From my cold, dead hand. Oh, shit. YouTube hooker. Who the hell is YouTube hooker? That's one of them damn troll accounts saying feminism is the reason men are dying from eating unhealthy. These narcissists won't stop killing men with their cooking. Oh man, even the troll accounts is coming in here telling jokes and shit. But yeah, man, I think that because you see the brother here, right? With the doctor. Obviously, he's getting a checkup or whatever. And I think that if you find a physician that you're somewhat comfortable with, I think you're probably more likely to go your ass to the doctor, at least to have your yearly checkup. You know, I think you're more likely. What's good, brother Big Pontiac? I see you up there, brother. I think you're more likely to go to the doctor if you're comfortable with, you know, the physician. I mean, because you got to think about it. I mean, we as black men, you know, sometimes we can be a little fickle about the people we want to be around. All right. We don't give a shit that your ass a MD. You know, we may not like your personality. We may not like your bedside manner. You know, we may not want an Indian doctor. We may want a black doctor. We may want a Chinese doctor. We may want a white doctor. We may, you know, so get you a physician, man, that you're comfortable with. If you're comfortable with the doctor, maybe your ass is more likely to go see him from time to time, because you're comfortable with him. He has a decent bedside manner. He gives it to you straight. He don't bullshit you. I mean, that is probably going to increase your doctor visits, if you and the doctor have a good rapport, because you're not gonna have a good rapport with someone that you don't kind of trust, right? Even if you only trust in them as far as your medical care, if you don't have a good rapport with this particular person, you're probably not going to be in much of a hurry to freaking go and see him for your annual checkup. You're just not. So that matters too. Um but y'all heard the stories, y'all heard the stats and the articles that I read earlier, man. We as black men, man, we have a tendency to be worse off health wise than any other group of people. um we're affected more by cancer and colon cancer and high blood pressure and hypertension and all these kind of things. We have a tendency to be affected by it more, man. Therefore, our black asses need to be going to the doctor more. I mean, we got to grit our teeth and bear it and get our ass in there, man. I mean, trust me, and y'all are talking to somebody, man, that I was the same way. I didn't want to go to the doctor, and I'm with a woman who stay at the goddamn doctor. She's got a primary care doctor. She's got an eye doctor. She's got a foot doctor. She's got a gynecologist. She's always at the doctor for something or another. For some type of checkup. But me, I'm just the person that bring her there and just be there with her. I would never go in there. But like I said, over the course of years, she was like, you really need to go, get a checkup, get yourself checked out, get yourself a primary doctor, all that kind of stuff. So, and like I said, I'm glad, that she convinced me to do it. I mean, because something go wrong now, at least I can get out ahead of it. Those articles said, we like to go to the ER. We don't want to go to the doctor till half of our head falling off. We walking in there with our side of our head taped on. That's when we go to the doctor. So shit got to be falling off, or gushing blood, or hurting us so goddamn bad that we can't sleep. Now we'll go to the doctor. We got to be gushing blood, boy, to go to the goddamn doctor. But my Chantal brother is up here, man. What's good, brother Perfect Black? My brother.
What's going on, brother X, man? This is an excellent topic, man, about black men's health, man. Because I don't think within the black YouTube spaces, in particular the black manosphere, that this is that the health of black men is discussed enough. And I think it needs to be discussed more, especially for black, all black men, of course, but especially for black men. They got people, who depend upon them,
Yes.
and who is, especially like myself, I'm the sole breadwinner of the home. I make it a point to make sure that I have, my affairs in order, and I keep myself in shape so I can stay, because I feel it's a responsibility. I think we have a duty to keep ourselves in our best and in optimal medical health.
Mm-hmm.
Especially when you got people dependent upon you. I think it's irresponsible to be, have people dependent upon you, and you're not at least doing your best to keep yourself in relative shape. So, and for me, my company gym, they about to start charging me rent because I live up in this son of a bitch. That was all they need to tell me, that they got a gym for the employees. I stab in that son of a bitch. So but staying active, man, eating right, because everything, all of this stuff plays a part. It ain't just diet. In other words,
Yes.
what you you can't just eat salads all the time and think that that's going to be it. No, that's why they call diet and exercise.
Diet
Diet
and
meaning
exercise.
diet and exactly, diet in terms of what you put in your body and what you don't put in your body.
Mm-hmm.
Okay. And how much exercise are you getting? Are you getting the right exercise? And not just exercise, but also staying active.
Yep.
You can't be sitting on the couch all day long. And I'm like you, brother, because I'm kind of a beer kind of I'm a beer guy. I like beer. That when I went to Germany, came back from Germany, man, and that was it. I got a good taste of some really good beer, and that was it, man. And I'm like, man, this Budweiser shit, that ain't doing me no good. I mean, because it doesn't have the taste that I like. I got that taste. I've been like that ever since. So I'm kind of bougie when it comes to beer. My beers are pretty expensive, and like you said, I like my whiskey and all of that. But again, I do my best to stay active and stay in the gym. I don't think I go to the gym no less than 4 times a week. And we're in the football season, so that takes away from a lot of the home life. But I think my wife, she appreciates it, because me being 47 years old, and I'm in shape better than most, people half my age, and so I think she appreciates that, man, and then that assures that I can at least stay around for as much as I can, So, about 20, I would say about 25 years ago or so, I gave up, and I used to smoke. I gave up smoking about 27 years ago. And that one, I went cold turkey on that. Yeah, I put that down, and that was it. And it's a mental thing, man. It is a mental thing. But I really started going, no fried foods, no pork, no soda. And you're right, the soda, man, soda will wreck your body because it's full of sugar.
That
And
should kill
especially
you.
exactly, especially in people that think that they're doing something good by going to diet sodas. Diet sodas are in a lot of ways worse. So, but there's you can't get around the 3 pillars, and that's diet, what you put in your body, what you don't put in your body, exercise. You're going to need to get it, not just lifting weights, but a good amount of cardio, and staying upright and staying active.
Mm-hmm.
If you don't do those things, you're not going to be in the best shape, right?
Yeah.
You're just not.
Yeah.
And I mean, it's hard at first, but you got to get into the habit of doing it. You have to get into the habit, right? And now I'm at the point to where it's a part of my daily, it's a part of my schedule, it's a part of my habit. Also, and this is something that my wife I had to teach her about this, and that's about getting up early.
Mm-hmm.
Getting yourself up as opposed to sleeping out during the even on weekends. I'm up.
Yeah.
You know,
Yeah.
so I'm up at the crack of ass dawn, and even when I go to, because I'm one of those rare people. I don't need a lot of sleep. I can go to bed at 1, 2 in the morning and still get up at 4 in the morning, and I'll be okay. And
Mm-hmm.
I actually thought that there was something wrong with me, but the doctor said no. There's a lot of times some people are like that. They don't really require a lot of sleep for their bodies to be okay. So, and I try not to abuse that, but I still get up at a certain time.
Yeah. No matter
So,
what time I go to
yeah,
sleep, I get up at the same damn
yeah,
time. It's
exactly.
like,
I get
it's
up at the
crazy.
same time every day, and my wife hates it, especially on the weekends. She would like that I sleep in. It's hard for me to do it, to sleep in, even on weekends. My body starts aching. I got to get the hell up out of the bed. I cannot
Hell
do
yeah.
it. I
When my
cannot
eyes open, I
do it
gotta
at
get
a
up,
time.
man.
Yeah, I cannot pass about 5:30, even on the weekends, 5:30, 6 o'clock. My body starts to ache and get the hell up out of the bed. I cannot do it.
Yeah. Yeah.
So it is a good thing. It's a needed thing, and if you're going to the gym, look, the gym isn't as expensive as you think that it is. I go to LA Fitness, and I go to my company gym. So the LA Fitness is, and I go to a signature club here in Chicago. So it's a little bit more expensive. But man, you can go to Planet Fitness. What, $10 a month? You can't afford $10 a month. Now, come on, man.
Yeah.
I mean, so we gotta stay in shape. We gotta take care of our bodies more.
Yeah.
You have to do it. Yeah, and,
Yeah,
and 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 like yourself, I'm somewhat of a grill master. You
yeah.
know, I am after because I love the grill. I do.
Yeah, man. I stay
I do.
messing with man.
I
Cause
do. I love the
I
grill.
got a serious barbecue grill, boy. My barbecue grill is
Yeah.
serious. Yeah, it's serious. Boy, got gas eyes and all kinds of shit on it.
I don't do
It's
gas, man. I don't do gas.
oh yeah, I
I
got a
don't do gas, and
gas,
I actually went away from charcoal. I do. I
the
try. Well,
mesquite. You
I
do
do
the mesquite.
charcoal, right? Mesquite, something
Hmm.
cherry wood or something like that. I try to do more wood than charcoal or a good mixture of the two. And
Hmm.
even then, I use a higher class charcoal. But I try to do mostly natural charcoal. And I know you know what that is, more natural
Oh
charcoal as
yeah.
opposed to the
Oh
packed
yeah.
one, because that's better. Because it gives a better flavor to the food and everything. I don't want to turn it into a whole grill thing, but I like the grill, man. I do.
Yeah, me
Actually,
too.
grilling is still better than frying your foods, and most of the foods that you eat, even in some foods you even eat in a restaurant.
Hmm.
Grilling is actually is grilling your meat is definitely a healthier way to eat than eating your food fried, and definitely going to McDonald's and all. Please
Oh yeah.
stay away from those foods. If you got a woman that cannot cook, get your ass in the kitchen and cook. Now I'm a better cook
Yeah.
than most men.
Yeah.
I'm there right now.
You just cook. That's all.
Right, I'm a better cook than most men, but that's the way that I've situated myself over the years. You know, because I like to get look, man. I love oxtails, love it. I love red meat. Now I don't eat it every day.
Hmm.
That's the thing. You everything within moderation. I love red meat too, you know, but I don't eat it every day. And I
Yeah.
feel that, and you know, I actually tried being a vegetarian. This is years ago when I was in the army. I couldn't do it, man. I lasted all about a week and a half. But I tell you, my sense of my sense of smell, it increased damn near tenfold. I don't know what that was, but I was told that's a natural outgrowth of your sense of smell. It increased. I couldn't do it. I couldn't do it because I do like to eat meat, but I did cutting it down, having it in moderation. I don't eat heavy at work. My job, I got a good, I work for one of the larger corporate law firms and probably in the world, and they take care of their workers, man. I mean, they grill, they feed them. You know, they have a lunch up there, and this is not just you know fly by night food. They be feeding lamb chops, and they feed
Hmm.
everything up there, man. It'd be some good, but I always eat me a salad at work. I always eat me a salad because I gotta have a salad at least once a day. When I come home, I still, I have my heavier, foods. But even then, I don't just pick out. In the morning time, I make sure I get several glasses of water in. I'm a tea guy during the day when I'm at work, so I get a lot of my, water intake and some because I'm a green tea. I like green tea, so I get that in. That's really really good for you. So you could eat healthy. It's just you have to plan it. You have to really plan it. I have a desk riser at my desk, so I'm not sitting down for most of the day. Most of the day, I'm pretty much standing up at my desk. So
Oh, you got one of those joints where you like
ergonomic desk. Yeah,
stand up at it. Yeah, yeah, yeah,
yeah. I
yeah.
can
I've
stand
seen
up. I
those.
can stand. I can
Seen
rise
those.
my desk up, and I can sit and basically do everything I need to do when I'm standing up. You know what I
Mm.
mean? And now I don't count my steps or anything like that, but I do have one of those step counters just to see what I see how I'm doing and all of that. But all of that little stuff counts, man. In turn, it adds up. These things here, what I'm talking about, it has a cumulative effect. It's not going to happen overnight.
Yeah.
I mean, it's not going to happen overnight. I'm naturally a small guy. I'm not a big guy. I played football in high school. I was into collegiate sports and all of that. But I'm naturally a small guy. If I don't go to the gym and lift and all of that, I'll probably be around 140 pounds.
Mm.
Right now, I'm 160. Last time I weighed myself was 163 pounds, man. And I call myself 163 pounds of twisted metal. But it's
Mm.
something I have to work at. You know what I mean? I'm not complaining about it because it's better than than just letting myself go. If I didn't, then I just get fat. God has blessed me with a really good metabolism. But So I had to work at mine. I had to work at putting weight on. You know, if I wanted to put some weight on, I had to work at it. You know, uh, but again, it's still the effects is cumulative in terms of the eating right and having activity. You know, planning your life around that. Once you start doing that, you will find that it's more habitual than
Yeah.
after all. It's a lot of hard work. For me right now, it's habitual, but it took a long time to get that way. You know, it took a minute. You know, I went through those days like, man, I don't want to go to the gym. Oh, I don't want to do it. I don't want to go to the, it took some time, but now, now I'm like, man, you know, my wife would want me to go to the store on the way home. Like, look, I need to get my hour in. I need to get my. I don't even like her calling me while I'm at the gym unless it's an emergency because
Yeah.
I'm so focused. I'm so focused on my workout. But it took time, man. Brother, when I tell you, it took time to get that way. It took a minute. It just didn't happen overnight. You know, it just did not happen overnight. Now, I won't even. And my wife, she likes to. You know, she's pregnant, so I'm kind of. Y'all you get what y'all say. My wife can't eat certain foods while she's pregnant. Nope,
Mm.
not happening.
Yeah.
Not only
Yeah.
she likes pork and all that. And I tell her, I say, yeah, you know, you want to eat that, that's fine, but you're not gonna do it while you got my child in your belly. Not happening.
Yeah.
Not happening. She
Yeah.
doesn't like it, but I'm sorry, not happening. You can call me controlling all you want. Oh well, she's not gonna eat that stuff when
This
she's
what it.
pregnant.
This is what it's gonna be, woman.
Exactly. It's like that, and
This
right,
is
it's like
what it's
that,
gonna be.
and I don't apologize for it. So, and but when she had me, because she's like when she you know she has a baby, she wants to make sure I go get her some wine, which I am. You know, had to go get the wine and all that type of stuff. She's not a real big drinker, but she loves pork, so she likes my Cause I'll grill her a rack of you know pork ribs and all of that. She likes that, you know. She just does. Not while she's pregnant.
Mm.
Not while she's pregnant. Not gonna happen. I have reduced a lot of stuff, you know, for when she's pregnant, because that stuff goes into your kids' long term health.
Yeah.
It
Yeah.
goes
It
into your
does.
kids' long term health. I just with our first child, it was the same way. You know, luckily she's not a lot. She's not like a lot of these other women who will be drinking and all that while they're pregnant.
Yeah. You know, they be drinking and smoking and doing all this kind of
Mm-hmm.
nonsense while they pregnant, and then once the kids is out, they feeding the kids a bunch of BS on top of that. You know, a lot of us, man, we started off with bad health off top because you know our parents was stuffing BS down our throats while we were children. You know, I talked about that, you know, because I talked
Mm-hmm.
about that one time where, you know, you got these obese kids and, you know, all this kind of stuff. And, you know, you can't blame the damn kid. You got to blame the damn adult who's feeding the kid. You
Exactly.
know, they're giving them, you know, Twinkies and ring dings for breakfast and shit like that. You know, I mean, you're already messing up this kid's health. You know, he's starting off with bad health before he can even get to be an adult because you know, mama pouring garbage down his throat, man. The whole
Mm-hmm.
time he's a child living with her. So, you know, there is that to contend with. But, you know, once you're an adult man, you know, the responsibility of your health is ultimately yours. You know, eat right, exercise, drink plenty of water, get a decent amount of rest.
Mm-hmm.
Um, you know, don't be a person that's always on your ass all the time. You know, you would think though, right? You would think that people who, I don't know, living in mom basement would be like the most healthiest people because guess what? They ain't got shit to do. So they can be down in mom basement doing all kind of calisthenics and the push-ups and sit-ups they could be doing everything. They could have a full routine because they down there 12 hours a day playing Call of Duty anyway. So why not take at least 1 or 2 of those hours and get you a workout in? If nothing else, you should be in good shape, you know, living in grandma's cellar, you would think.
Yeah, and you're absolutely right, man. And somebody said in the chat, as you know, don't lifting weights destroy your joints. If you're not lifting properly, yes. A lot of people they either go too hard and they don't have the proper workout routine. Um, the thing is, you can't work the same muscle groups 2 days in a row. You have to give at least you have to give some time for your body for recovery. A lot of times people don't do that. Adequate warm ups, while you're lifting and all of that. So over the years, my workout routine has changed and all of that, and also depends on what your goal is. What are you trying to do? I mean, you're trying to get really yoked all up, or you're just trying to stay cut up and keep it and maintain that. Because it really just like myself, I was at a point. It was at one point when I was in the army, I was really trying to get really yoked up, and but the problem is that the older that you get, um, you have to maintain that, or else it turns to fun. So what I did, I started to kind of wind down on that powerlifting stuff, which is not bad because you keep your strength up and all of that. But I have to wind down on that powerlifting, not because of joint reasons or anything like that, but because at the older that you get, you still have to maintain that stuff because you just let yourself go or just stop getting out of the gym. Especially if you don't have a really fast metabolism, that muscle will turn to fat. So, and I don't know when my metabolism will start slowing down, but I don't want to, count on that. So I started to really slow down up on the powerlifting, but still keep myself really cut up pretty good, which is where I want to be, because that's easier to maintain and everything. So to answer your question, no, it can if you have the wrong workout routine, if you if you're powerlifting every single day the same muscle group, yeah, you're gonna hurt yourself. You're really gonna hurt yourself. You're gonna overexert yourself. You're gonna you will start to mess your joints up and all of that. So yeah, they can, but if you're doing it right, no, you'll be fine.
Yeah. Brother BMT, he
Yeah, I
says,
saw BMT.
what's wrong with a pink feet and a jaw moonshine? And then he freaking says, I'm not giving up grandma and the church lady's Sunday dinner. I can't do it, X. I'm not saying give it up, but you may not want to be eating them chitlins and all that kind of foolishness that they be cooking down there at the church, man. You might want to leave that alone.
Yeah, you may
Eat
want
the
to
other
leave
stuff.
that.
Eat the other stuff.
Anything. I can't eat anything where literal shit once roamed. It ain't enough Washington on the planet that you can. There is no soap. There isn't enough vinegar or whatever to use to disinfect. There isn't enough. It's just not. I'm sorry, and and I understand. Black folks. They're really connected to to soul food and all of that.
Yeah,
but
yeah.
I've always been kind of against that because it's some of the worst food that you can eat. Some of the most unhealthy food that we can eat is soul food. Now, I mean, I know some probably people want to, stab me with some pickaxes and everything, but it's true. It is highly greasy food, heavily salted, and for people that is ravaged with hypertension, that's some of the worst food that you can eat.
Yeah.
So I understand. There's a connection with that. What I understand. I understand why our ancestors did it, because that was all what they were left with. They was making the best of what was given to them. But now we are in a position we can eat better now. Yeah. We don't need to fry every goddamn thing. We don't need to put a slather of lard on every damn thing that we don't need to. We don't
have to eat chitlins.
Right. We don't need to put sugar and salt on every damn thing. We don't need to do that. Back then, yeah, pig ears and pig's feet, that was scraps. I don't think we should be proud of eating scraps.
Yeah.
They ate that food because the slave masters gave them nothing else.
I grew up on that shit because, I was raised by Geechee from Georgia. So, I mean, I was raised up on that shit, man. I was raised up on fucking pork and
So was I. Yeah,
chitlins
so was I.
and all that kind of shit and everything else. Cause shit, we would have gator and fucking rattlesnake meat and all kinds of shit. You know, my old man had all kinds of shit in that damn deep freezer. But you know, once I got to be an adult, I was like, okay, I got to get away from these damn chitlins and hog mogs and hog heads and pig's feet and all so kinds of bullshit, man. I got to get away from
Man,
this
that's the
shit,
worst
man.
meat to eat on the planet is
Gotta
pork.
get
It's the
away
worst.
from
I'm
that
not a
shit,
Muslim,
boy.
but that pork is the worst meat to eat on the planet. No
Yeah,
matter how you prepare it.
I used to be a Muslim, man, and shit, man. We did an experiment one time, and I talked about this before. We took a frozen piece of pork,
I did that too. I know you're going.
put it in a glass jar, closed the jar, and put it out in the sun. After about 2 days, you know what was crawling around in that jar?
Worm.
Maggots.
Yep.
Yep.
Maggots.
Now, how did them damn maggots get in that jar unless it was already
It
in
was
the fucking
already
meat?
there. The larva was already there.
It was already in the meat, man. When I saw that shit, I was like, man, I will never eat another piece of this shit again.
You shouldn't be eating any meat that, as the Bible say, that from any animal that doesn't quote unquote chew the cud.
Mm.
And basically, what that means is the reason why the cows and all they have several stomachs to filter the food.
Mm.
Well, pigs don't have that.
Mm-mm.
You might as well be eating a human being.
A pig don't even got any fucking veins, man.
No.
I remember
Pigs
going
are
to my.
meant to eat the scraps of the earth. They're meant for that. They
I
are
used to,
they are nature's garbage disposal.
yeah, I would go to my grandmother's house, right, when we were kids, because my grandmother had a place. My grandmother had a 60-something acre fucking ranch in Bladen County, right? And she had, she had horses and donkeys and pigs and all that kind of shit, right? And what she would do, she would take the pigs, because there was like a little swamp down there where she would like we would go out there every year and clear out, right? And what she would do is she would let the pigs run through first. And as a kid, I used to be like, why you let the pigs run through first? Because she said if the pigs run through, they'll be able to flush out the snakes. And if the snakes bite them, nothing will happen to them because they don't have veins.
Yep, that's true.
Yeah, she used to let the fucking pigs run through the damn swamp, because it'd be moccasins and shit in there, them fucking them water moccasins and shit. So she let the pigs run through there first, and they would flush out all the snakes, and even if the snakes bit them, nothing would happen. They'd be fine. Yeah, they'd be just fine. And I just thought that
Then
was
they
the
turn around
weirdest
and put
thing.
them on the grill with snake venom.
With
in them.
snake venom.
Mm-hmm.
Yeah, man.
Yeah,
I was a little kid. I never
that's
forget
not
it.
good meat to eat, man. That is
Yeah,
horrible.
man.
Well, I wasn't gonna stay up too long, man. And if you hear my daughter in the back, she's getting ready to go to bed.
Yeah, well, I was just, this wasn't even really like a major stream. I just wanted to get up here and talk because, I had read a couple articles, and the reason why I was reading the articles, because all we've heard over the past like week or two is, women's health, women's health, women's health. And it's like, no one ever talks about men's health. They definitely don't talk about the black man's health. So, I just want to get up here, man, and chop it down with the brothers, for a little while, man. And basically, not to tell brothers, but to ask brothers to, consider your health. If not for yourself, I'll say again, for your wife, for your family, for your children, because people depend on you, brother. All right. People depend on you, and something happened to you, a lot of shit gonna fall apart. I know it will in my house. If something happened to me, a lot of shit falls apart. All right. A lot of shit falls apart. Of course, they get a few pennies, off my life insurance and shit like that. But me not being here would be a serious thing. And I know it's a lot of brothers out there. It's the same thing with y'all. Y'all not being there, man, for your family and your wife and your kids and everybody, man, would be a serious thing. I don't think we should not go to the doctor, because I know, like I said earlier, brothers, we don't want to go to the doctor because we're scared what the doctor gonna say. He might say we dying. He might say we got cancer, we got a tumor, we got an aneurysm. I don't know. But still, get on up in there, man, and listen to what the good doc got to say, man. You might be surprised. You might go in there and he'll be like, well, you just got high cholesterol. Take care of that, you be good. He might go in there and say, well, your blood pressure's a little high, but if you change your diet and exercise a little bit, you'll be good. You don't know what the doctor gonna say. So don't let the fact that he may possibly give you some gloomy, doomy news keep you from going up in there, man. Because at the end of the day, man, it is entirely up to you. It's not up to anyone else, man, to get you to go into that doctor's office, man. It's up to you to go there. And like I said, I'm somebody, man. I wasn't going to the doctor either. I wasn't. I was like, I don't need to go to no doctor. I don't need to go to no doctor. But I started going to the doctor, number one, because my wife was like, oh, you need to go to the doctor. And then I had a real health scare a while back as well. So, I mean, take it from me, man. It's better to know than not to know. All right. It's better to know than not to know.
Yeah, indeed, man. It's again, things change, man, when you got people depending upon you.
Oh yeah.
And so, because I know, before my wife, man, hold on.
Yeah, it's better to know, man, than not to know. I mean, because see, once you know, now you can do something about it. If you don't know anything about it, if you don't know what's going on with you, you're not going to do anything because you don't think anything is wrong. You don't think nothing's wrong. So you're just going to go on about your business and,
Yeah. Because, before my wife, man, I would go, man, a few years before I even had a checkup.
Yeah.
And once I got married and the second time and got kids, we got a daughter and she's pregnant. So that changes things, man. I mean, because you were just saying it, man. I can't imagine if something happened to me, what would happen to them.
Yeah. What happens to them?
Exactly. So I think I think it's I'm a bit harsher when it comes to stuff like this. I think it's a bit irresponsible.
Yes. It
For
is.
right, exactly, for a man to, have people dependent upon you like this, and you're not doing your part to take care of your health.
Yeah.
And that's irresponsible. That's irresponsible that's in my humble opinion. That is irresponsible.
It's important, man.
Yeah, I think you have a duty to be at you owe that. I think I owe my best to my family, and part of being my best is being my best healthy.
Absolutely. Being healthy, being alive, and
Mm-hmm.
being able to continue to do the things you need to do, man, for your family, man.
Right, and know when things are, go through the proper test, because once you get, once you get up in your 40s, that you got to get yourself checked for certain things.
Mm-hmm.
And I've had to schedule myself for some, certain checks and all of that years before I didn't think of having to do it. But now, I'm gonna go ahead and do that stuff, and I've got it all scheduled. So I'm just, and that's part of being responsible. And that's my daughter.
Yeah. Because a lot of things are preventable, man. I mean,
Exactly.
it's one thing something happened to you, you get hurt, you can't do nothing about that. But the preventable stuff, man, there's no reason to be dying of something preventable. There's no reason. If it's preventable, why your ass dying from it?
Exactly. Exactly. So, but I'm gonna get out of here, man. My wife, she's about to put the little one down here, and I don't want to keep him up. Because I'm in the room with the big computer, not the laptop. So.
Oh, okay. Well, I'm about to close out in a few minutes anyway. I'm just gonna, go down because I got a heavy stream schedule coming up. I got a lot of shows planned, so I gotta hit them in the head with some of my programming notes. And I'm gonna wrap it up.
Indeed. But after we do have to do more of these health conscious streams, when it comes to Black men, because that's important. Hypertension, there are certain things within the Black community like hypertension because it runs through my family. That's another reason why I stopped, started eating healthier, because it runs through my family. I've had several relatives die of that alone. So yeah, I try to keep an eye on that. So I don't think this space talks about this enough, and I
Yeah,
think it's
man.
important that Black men need to really take care of their health a lot more than what we have been taking care of our health.
Yeah. Plus, there's no shame, man, in taking care of yourself, man. Like it's like we fear some type of shame
Hmm.
by doing the right damn thing.
We think
Like
it's weak.
it's
We think it's
yeah, it's
weak.
crazy. Yeah, it's weak. If you do the right thing, you're weak.
Right.
That's stupid, man. We got to get out of that mind frame, man. We got to get out of that. But I
Exactly.
appreciate I appreciate you coming through, man. As always, man, brother, perfect black man. You welcome up here anytime, my brother.
Yeah, man. Thanks a lot, man. Thanks. Let me get that off because I can go on about this topic too. So thanks a lot, man. Thanks for having me.
Absolutely, my brother. Peace. Yeah, man. We probably gonna go ahead and just wrap it up, man. I didn't want this to be too long. I actually went over the amount of time I wanted to go. I only wanted this to be like an hour, and we creeping up on what, like an hour and 50 shit 2 minutes. God damn it, damn near 2 hours. But before we go, you know, I gotta hit y'all in the head with TPOT's programming notes. Yeah. And we got quite a bit of programming notes, good folk. Um, because the TPOT YouTube page is rolling along. And yeah, man, we got a lot of shit lined up, man. Because we're gonna be streaming for like the next 3 days, folks. Yeah. Usually we only stream, Wednesday, Thursday. But this particular week, we got so much going on that we are actually going to be streaming every day up until Saturday. And then we're going to be streaming on Wednesday as well. So let's start with tomorrow. Tomorrow, Thursday night, Dark Exodus returns. And of course, we're back with another version of these old mamas. But what I decided to do is to break out some of my stuff from my archives. So I'm going to be sharing some new stories with y'all that y'all haven't heard from me yet. And I got some doozies. But see, we're not going to so much get into the stories. We're actually going to get into the thinking and the psychology of it, because I got some good reads, all right, for it, quite a few good reads. And what we're going to do, man, we're going to go down into the crevice of it, man, and try to find out why these women killed these children. We're going to try to find out why they do it tomorrow. And y'all will be surprised, man. It's not just black women that we're going to be talking about. We're going to be talking about, y'all are going to see black women, white women, Latino women, Asian women. Yeah. Because I got quite a bit of this, man. I got an archive of this shit. Like I said, I'm breaking out stories that y'all have never seen before. Y'all have never heard me talk about them before. You may have seen them before, but you've never heard them talked about on TPOT. So I dug into the crates and dug out some stories. And we're going to talk about them tomorrow, man, right here on the TPOT YouTube page. You Negroes know. That's tomorrow, 9 p.m. Eastern time. And then Friday, my man, Spiritual Logic, aka Hulk, will be here, and we will be asking the question: is God real? Yeah, that's gonna be a good one too, man. Friday night, Brother Hulk will be here. Those of you who are familiar with Brother Hulk, um, if you watch his channel, you know what he talks about, man. He talks about the Bible. He talks about how the world correlates to the scriptures. So Friday night's gonna be good. Yeah, Friday's gonna be good. Make sure you hear. I was trying to get Rod of God to come as well, but he couldn't make it. But Friday night, my brother, Spiritual Logic, will be in the house, and we will be asking the question, is God real? And then Saturday, the ridiculous race game returns. And I got a good cast of characters. I know y'all see these people up here. Most of the people that you see won't be here. Some of them will, but most of them won't. But the ridiculous race game returns 8 p.m. Eastern time, Saturday night, right here on the T.P.O.T YouTube page. And this particular week, because the ridiculous race game always has a particular theme. This week's theme is law and order. That's right. Law and order. We'll be asking, are the laws racist? Yeah, I'm going to be pulling up some laws, and we're going to be talking about how racist they are and how racist they are not. Because like I said, y'all know on the ridiculous race game, we talk about bigotry, discrimination, prejudice, and we have a few laughs at racism's expense. And y'all know on Saturday night, we jump off a little early. We jump off at 8 p.m. Eastern time instead of 9 or 9:30. So make sure you're here to catch the ridiculous race game. And then next week, we are right back at it because we got a debate coming down through the pipe. Wednesday, my man, Brother Big Nate, will be here, and Brother J.I., and they will be discussing morality and termination rights. Yeah. So we got a few good shows, man, coming down the pipe, man, over the course of the next couple of days, man. So check us out, man. You gotta like one of these goddamn shows. So let's have a recap. Wednesday, 9 p.m. Eastern, Brother Big Nate and Brother J.I. square off on morality and termination rights, with this whole Roe v. Wade thing coming down, so I'm assuming it's going to get quite heated and contentious, so it should be good. And then Saturday, the ridiculous race game returns 8 p.m. Eastern time. Friday night, Spiritual Logic will be in the house and we'll be asking the question, is God real? And tomorrow, another dark exodus when old mama wants out of her day. And the reason why I'm doing this is because, every year when it gets close to Mother's Day, I do one of these, special tributes to your old mammy. So this is my old mammy tribute. So it's going to be a good one. It's going to be a doozy. Make sure you are here tomorrow night. Oh, yeah. It's going to be whatever you expect and then some. I promise. But yeah, man. So we're going to go ahead, man, and wrap it up. I appreciate all of y'all coming out tonight, man. I appreciate the super chats, and I got a cash app from my man, Brother A Truism as well, man. I forgot to even mention this shit. I appreciate that, Brother A Truism. I appreciate the cash apps and the super chats, man. But most importantly, man, I appreciate your participation, man, more than anything else, man. I don't take you good folks lightly, man. I never have, and I never will, man. You got my word on that. I just don't want brothers to end up like this, man. I don't want you laying in a hospital bed with your wife crying and your baby looking at you. She don't know what's going on. And this happens to so many of us, man. And often it happens by way of preventable things. Now I know, man, life ain't always as simple, man, or black and white as we want it to be. I understand that. And some things you can avoid. Some things are just purely unavoidable. I get it. But I think we got a good shot at avoiding having high blood pressure. I think we got a really good shot at avoiding um, having certain diabetic related things. We can control our weight. We can control how much sugar we eat, how much salt we eat, what kind of food we eat, how much exercise we get, how much sleep we get, how much activity we get. We can control these things. These things are 100% controllable, especially as an adult. You can control what you put in your damn face, man. You can control whether or not you spend 9, 10 hours on the couch. You can control whether or not you take in a lot of salt and sugar and grease and corn syrup and trans fat. You can control all of that, man. You can. All of that is controlled by you. All of it. Controlled by you. And you folks in here. So the things we can control, man, we need to take control of. You want your family standing around a hospital bed like this? Your wife crying, your kids crying over some BS that could have been prevented if you just would have did the right thing, ate the right way, exercise some damn time, get off your ass, stop drinking them goddamn Pepsis and Cokes and Sprite and bullshit. Quit eating them motherfucking pig feet. Trust me, you can live without the fucking pigtails and pig ears, man. You can live without the motherfuckers. You can live without meat totally if you wanted to. So I know you can live without that shit. You can live without it. You can live without all the salt, the sugar, the fat, the grease. You can live without it, man. You can live without McDonald's and Burger King, and you can live without that shit too. You ain't gonna die if you stop that shit. And forget the health benefits, man. When you lay off of that shit, I'm gonna be honest with y'all, man. When you leave that shit alone, you actually start to feel better. You feel better when you leave that bullshit alone. When you stop taking in so much sugar and salt and fucking cheeseburgers and fucking French fries, and stop eating motherfucking devil dogs and ho-hos and Twinkies and bullshit. You feel better. You leave a lot of that fucking red meat alone, guess what? Your ass won't be on that fucking toilet all the time either. I know people got you believing that you're supposed to take a dump every day, but that's not true. At least that's not what my doctor told me. You ain't supposed to take a dump every damn day. You take a dump all the time. You know why? Because you eat a lot of fucking meat. You eat a lot of meat, you stay on the fucking toilet. Because guess what? What your fecal matter is what can't be digested. And there's a lot of stuff in meat that cannot be digested. Therefore, it passes through you a lot. I tell you what, take a week off of not eating meat and watch how little you'll be on that fucking toilet. I'm telling you, man. And that's honest. Yeah, I know, we all raised up to think you're supposed to take a dump every single day. Not true, man. That's not true. But again, it's up to you, man. I just want y'all, man, to think. If you're not going to think about yourself, I'll say this again for a fourth time tonight. If you're not going to think about yourself, think about the people who depend on you, man. Think about your health for them. Your wife, your family, your children. And who knows? You do it enough for them, God damn it. Maybe you'll start to do it for yourself after a while too. So your ass will end up like this. But that's all. Once again, man, I appreciate everybody coming out tonight, man. Like I said, man, I don't take you good folks lightly, man. I never have and I never will, man. You got my word on that. Make sure you hear tomorrow, man. Thursday night, Dark Exodus. When it comes to the annual Old Mama tribute, we make it memorable. We make it memorable. So make sure you hear tomorrow, man. 10 p.m. Eastern time, right here on the T.P.O.T YouTube page. You Negroes know. So with that, I will leave you good folks with 3 words, like I always do. Open your mind. Peace, folks. What about this? What about that?
What about that? What about that? What about that? What about that? What about this? What about this? What about this? What about this?
What about that? What about that? What about this?
What about that? 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 What about this? What about this? What about this? What about
What about that? What about this?
What about that? What about that? What about that? What about that? What about this? What about this? What about this? What about this?
What about that? What about that? What about this?
What about that? What about that? What about that? What about that? What about this? What about this? What about this?
What about this?
What about that? What about that? What about that? What about that?
Only from T.P.O.T. Media. Open your mind.